And concussions aren't the only injury that athletes and parents should be concerned about. There is a new study that recently was published in the Neurology journal Brain that shows that repetitive non-concussive hits can also cause the degenerative brain disease known as CTE. Dr. Kalra, neurosurgeon at Medical City Lewisville, joins us now to tell us more about this study.
So what they did in this study was they took 4 unfortunate athletes, all in their teenage years, that died, and did an early post-mortem biopsy and noticed that they were starting to see quite a few changes in the tissue of the brain, and then related these tissue findings and said, is this early signs of what they call chronic traumatic encephalopathy, or also just repeated hits causing injury to the brain? So they developed a mouse model in the study and did similar hits to mice heads and started noticing similar changes. There was only 4 teenagers in the study, so it's not a very large study, but what they found was that hits to the brain, whether in mice or in adults, or teenagers in this case, do result in damage to the underlying brain tissue without it getting to the extreme of what we call a concussion. So if you and I hit our head on the side of a door or a car, we get a little stumbles, but we continue walking, and that's what they're looking at, is these little hits rather than the classic concussion hit where the player lies on the ground, is confused for a couple of minutes, is taken off by a stretcher, and then later diagnosed with a concussion.
So if what you're saying is that all hits are now a concern, what should parents and coaches look for?
Well, it's quite scary because you look at sports such as soccer, football, hockey. I mean, these are all contact sports in a way. I mean, boxing, most teenagers aren't doing, but field hockey, ice hockey, all of these are quite common sports throughout the U.S. What neurosurgeons as myself always try to tell people is avoid any head hits. So I have a 3-year-old at home, and I always tell my wife, not the head. So, he wears a bike helmet. The thing that's most important about protecting our children is to avoid any direct hit that's curved. So in football, they're outlawing where people come from the side and do a side swipe, which causes sort of a rotational hit. I got a chance to listen to the one of the neurosurgeons that's on the NFL concussion committee, and that's one thing they've been working on is to avoid these rotational hits that can cause the brain to sort of shift in 2 directions, just like getting T-boned in a car versus a head-on collision. The head-on collision, we have airbags. The brain is able to tolerate a head-on hit much better than a T-bone collision.
So anytime there's a side hit specifically, that's something they should look out for. What then do you look for if you're a parent? Like, I also have a 3-year-old, and my son slipped and fell on our bathroom floor. It's hard to know, when is it possibly a concussion? When should you go to the doctor? What are the steps you should take if your child does get hit in a way that concerns you?
Sure. The priority here is repetitive hits. We're not, all children fall. The head has a certain amount of reparative capabilities. The head, the skull, the brain all have, and in children we see that kids are able to bounce up and they continue running around. It's the repetitive hit. So if you do get a teenager that got a hard hit, take them out for a couple minutes of the game. Make sure they're doing okay. If they're starting to develop a headache, if you notice that they're just saying that I don't feel as great, take them out of the game. It's not worth getting repetitive hits.
And once again, that is Dr. Kalra, neurosurgeon at Medical City in Lewisville.